Thank you, Dr. Lio. Actually, that was a great transition to our next set of questions, which are about accessing clinics and hospitals during this COVID pandemic. So one of the questions we had is, so firstly, suppose that I am experiencing certain symptoms that make me worried that I might have COVID. When should I be at home and observing myself for symptoms instead of going to a physician?
So, like I said before, the vast majority of people who get COVID are getting it with just mild disease or maybe without any symptoms at all. So if you're not having anything that's severe, like you're not having bad chest pain, bad shortness of breath, really bad diarrhea, you're not getting really dehydrated, if you think you can manage it at home, then you should be at home. The reason for that is because there is no treatment for it. So you only want to be in the hospital if there's something that the hospital can do for you. So they can give you oxygen if you're having really bad shortness of breath, or they can give you fluids for dehydration if you're not able to keep water or other liquids down. But if it's something like a runny nose, or you're just feeling a little crummy, you're feeling a little tired, the hospital doesn't have any treatment for that. And by going to the hospital, you may be exposing yourself to other diseases as well. So you don't want to go to the hospital if your symptoms are mild, but if they're severe, again, if you have any chest pain, if you have any shortness of breath, if you have really bad diarrhea, if you're getting dehydrated, you can't stand up, those are reasons to call 911.
Now, okay, so I have a next question for you on the same line. So if I get sick, whether it's with COVID or not at this point, can I just visit any hospitals?
Yeah, the hospitals are still open. You can always go to an emergency room, and they're all taking patients. So yes, if you have an emergency, call 911. Apart from emergency rooms, some clinics are still open and they're still seeing patients. So definitely, if you're sick, call ahead, make an appointment, and let them know what your symptoms are so that you're not mingling with some of the other people at the clinic. But yes, there are still, hospitals are open and there are some clinics that are still open at this time.
Thank you, Dr. Lio. The next question is, if I am uninsured and I feel sick and want to get tested for COVID-19, who should I call beside 911?
Yeah, if it's not an emergency and you want to get tested, don't call 911. Check in with one of the testing facilities. University of Chicago has a testing facility, and their number off the top of my head is 773-702-2800. So you can call them, tell them your symptoms, and they can get you a time in to get tested. There are other facilities open that may be closer to you, but you'll have to just call them and set up an appointment. Definitely, if you feel like it's an emergency and you need help right away, then call 911. But for the testing facilities, you can just call them directly. And in terms of insurance, the University of Chicago, if you get tested there, it's free.
All right, thanks for that. And then finally, when will there be widely available drop-in testing in Illinois?
I think the state is actively working on that to increase the testing capabilities. It really depends on where you are, because some places will have enough and some places don't have enough. I know where we are right now with the University of Chicago. They've recently, as of last week, expanded their capacity to do about 1,000 tests per day. And so there's still a lot of capacity here. If you need a place to get tested, you can come to the University of Chicago to get tested. They have a lot more tests that they can do for you.